This is going to be an extraordinary panel with amazing 4 women. I've been asked to MC this first ever luncheon about women in health policy, or WHIP. And stay tuned because you're definitely going to be hearing more about women in policy this year. But before I introduce our panel, I'd like to thank Heather Bresch and the Mylan team for sponsoring this luncheon. So here's to Mylan, and thank you very much. So in no particular order, I am not reading big bios. Everyone can look up, these women are all very famous in their own right. Dr. Rebekah Gee is the Secretary of the Louisiana Department of Health, the state's largest agency with a budget of $14 billion. And right now, she'll explain to you about the expansion of Medicare within the state. Under her leadership, 470,000 Louisianans are now newly insured because of this Medicaid expansion. And for the first time, many more are receiving needed primary and preventive health care. Dr. Gee is also an OBGYN, speaks fluent Spanish, is a dancer, and just an extraordinary, I say this like really, like a real, these are kick-ass women. I just want you to know that. Carol Lynch, who you heard from earlier, is president of Sandoz US and head of North America. In this role, she oversees Sandoz's commercial operations in the United States and in Canada. Previously, she was the global head of biopharmaceuticals at Sandoz, where she delivered a portfolio with 5 biosimilar approvals with an annual sales of $1 billion. Silvia Perez from 3M. She's a president and general manager of 3M's Drug Delivery Systems division, which partners with leading pharmaceutical companies to make inhalers and transdermal patches, things we use every single day. She serves in the 3M Healthcare Business Group's Global Operating Committee, and she's a member of 3M Company's Executive Leadership Conference. And last but not least, Fran Zipp. She is president and CEO of Lachman Consultant Services. She is an expert in compliance enhancement. She develops program solutions to assure compliance, and with good manufacturing practices, she helps deliver strategic guidance and implementation of effective solutions to clients that she serves on a global basis. So get ready for some fun and some really offbeat, cool women. So I have asked them, yeah, they're worth a round of applause. I will just say that it says something about women in medicine, women in pharma, women in leadership, that we would have a panel this diverse and yet with so many common denominators. I'm just going to put my own bias out there. Women really like meeting new women. It's really fun. And this is a real kick for me, so thank you. We've been talking at this conference about the hostile environment that's out there. And having been a journalist for a long time and a practicing physician, and I worked at J&J for a while, I watched this sort of take place, at least in the United States, where pharma became the new tobacco. What can we, as women, who speak to our children, speak to global audiences, lead within our own organizations, do to sort of right the boat? And I'm going to start, and I'll throw that out there for anybody. All right, Carol.
Okay, I'll go. Well, I think we have a really important role to play in making sure that the benefits that we bring to healthcare systems is really widely known. And I think we are probably, as women, more likely to engage in a conversation about the good that we do for patients and the impact that we make each and every day. I think it's something, generally we're seen as caretakers in the family, responsible for family health. And understanding the role that our industry plays in making sure that we can all live long, healthy, and happy lives is really important. And I think some of the things from an industry perspective that I've noticed of late is that, there's often a lot of discourse around all the things that are wrong in the healthcare system today. And we're always talking about the things that could be better and, if only. And I think we need to start talking a little bit more about what the solutions are and be on the solution side of the discussion. Because too often we all gravitate towards the what's wrong side of the conversation. So I think we can really play a role in making sure that we bring much more solution-oriented, understanding the needs of different stakeholders in the environment in which we work, so that we can really see how we can forge a path forward where everybody can win in some shape or form.
I agree with you, Carol, and I also think what we need to do is we need to make it personal. And I think that's one advantage that we all have. If anyone says business is impersonal, they should find another job. Everything that you do, you have to make personal and show a passion towards it. So in addition to the stakeholders that we deal with in our professional life, we have stakeholders in our social life, in our families, our neighbors. Showing that passion for what we do as an industry really will go a long way in changing some of the perceptions.
And I think the only other thing I would add is that people that are attracted to healthcare and the pharmaceutical industry or the generic industry have an altruistic part of their being and look at that bigger effect you're having in the society. So making sure that you're bringing back to your organization, what is that we ultimately are doing? What are the benefits to patients? And keeping that alive and present. It's always we are running, and we don't always stop to think how many lives have been impacted by the work we do. And that can then extend, like the work AAM is doing through the campaigns we have created.
Do you guys find yourselves on the defensive more than you would expect? Rebekah?
I'll talk about this as a female. So I'm Secretary of Health for Louisiana. This is the state with the largest pay gap for women. This is the state with the fewest number of women legislators.
Let me stop you there. The largest pay gap meaning a man makes $1 and a woman makes
63 cents on the dollar.
Okay.
So 11% of our elected legislators are women. So I'm constantly battling. My favorite moments are when I'm at a hearing and I operate a $14 billion budget, and there's a difficult question, and there's one legislator in particular that says, "Okay, Dr. Gee, don't worry about this one. That one's for the guy." Now my CFO, who's formerly a man, is a woman, so he's going to have to deal with women. But there's so many meetings I'm in when men won't even, and this is unique to, I'm a native of Utah, lived much of my life in the Northeast, love Louisiana, now have 5 children and a family here, love it. But definitely different attitudes, and I'm in many meetings where men won't look at me. My chief of staff, Pete, who's probably here, who was 28 years old when he started, I had many meetings where they'd look at Pete and say, "Pete, what do you think?" And I was sitting right there in the meeting. So I do think it's important to set an example, and particularly in places where there are not a lot of females, to pave the way and to show your competence. Last week I was at a meeting and I had, at a conference, I had one phone in this ear and the other one on this ear because I have 5 kids and lots going on. And the guy said, "How do you do that?" I said, "It's multitasking, and the second X chromosome was built for that."
I'm going to ask the thorny question for all the gentlemen who are in the audience, but it's something that needs to be touched on. And that is women in the C-suites and how we promote each other and bring the next generation of women up. How necessary are men for us to achieve parity?
So I'll start with that question. And at 3M, it has been a very important initiative to increase the number of women at the highest levels of leadership. And as we embark in this journey, one of the most critical elements of accomplishing that has been men as allies and making sure that we have a joint force between men and women in that journey. And today a lot of the hiring is being done still by men. A lot of the coaching and mentoring can be done by men, and we need to work together. So having men actively engage in that cause is very critical.
Fran, what do you think?
I agree completely with what you said. I also think women have to support women. Lots of time in the workforce, you really don't see that camaraderie between women.
That breaks my heart when you say that.
Yeah.
I want to not believe that when you say that.
Well, I don't know about anyone else's experience, but it is very true, especially as you go up the ranks. There's only a limited number of C-suite positions, and when there's another woman who's there, the support isn't always evident. So I think women need to support women, but I also think as women, you have to take a step back, and I always say that I may not be the most qualified for a position, but I always wanted it the most. And it's that wanting it the most and that, drive and sharing that with both men and women, I think that's what'll help more women rise to the appropriate positions.
Now, I fully agree with the paying it forward piece, right? Because we get there because others saw something in us and gave us the opportunity, and I think it's our responsibility to make sure that we pay that forward as well. And I fully agree with you, Fran. I think often that's not consistently applied across different parts of the organization. Although I have to say, over the last couple of years, I've really seen that being very different. I see a very strong female community in the organization which I work, and very much supporting each other behind the scenes that I didn't experience much earlier on in my career at all. So I think there's a lot of positive momentum in that stake.
Don't underestimate when we're in these leadership roles how much of an agent for change we can be. In my own organization, I took a look at all of the physician salaries and realized that women were making $40,000 less than men for no reason whatsoever other than their gender. And so I think even though we advance, we got to take folks up with us and not just be happy for our own success. The other thing is that in my career, and I don't know if this is true for yours, but the folks who have been the biggest impediment have been women, the people that said I wasn't qualified or weren't helpers to me. So I don't want to say it's not just the men, for the men out there, it's not just you, because I think there is this attitude of I got here so you struggle too. But I think our attitude needs to be, let's help everyone up.
If you look at women in the young parts of their careers, when they seem to be on track for great success, what gets in people's ways? What are the impediments to keep a talented woman from achieving the C-suite or a CEO position or head of a trade organization? Are there self-imposed grenades that just don't have to be there?
So I think we've taken a look at this actually in our organization, where we said, if you look at succession planning at certain levels, that the women were just getting stuck at certain levels in the organization. And unless they can really break through that to the next level, then they weren't going to make it to the C-suite. So we actually interviewed more than 80 people around the world to ask them, why is it that you're not putting yourself forward? Is it that you don't want it? Is it that you want it but you don't know how to get it? And we got some really great insights. And I think there's a real mix of things to do with, as you say, some self-imposed constraints, like we can be our own worst enemy sometimes, not speaking up and saying what it is that we really want. But also some misconceptions around the need to be able to relocate, to move the whole family. And that was a big issue. I mean, if you have 5 kids, it's quite disruptive, right, to start moving people around. And so actually we spent a lot of time saying, okay, how do we make this easier for people? And so last year we introduced this amazing flex work program for everybody, not just for females, obviously. And I think that's really opened up people's minds around how you can take a job. So for example, somebody who was in my leadership team who now sits on our executive committee with me on a global level is doing a job that traditionally was based out of Munich, but is now doing it based out of New York. And just traveling. I mean, we travel all the time anyway. Where does it matter where you land? So long as you're in the right place at the right time. And that's been really helpful for her to step up and make that change. So I think some of that workforce flexibility is really important as well.
I also think, along the same lines, a lot of women think about that they have to make a choice. Will I have a family or will I have a senior level career? And, I have 3 children, and I raised them by myself. And you can have both. You can have a senior level career and have a family, but I think that holds a lot of people back just because, especially in the US, I don't think we are as caught up as other countries, many other countries, on parental leave as we could be. And people don't apply because they think they have to give up a major portion of their life.
The one thing that I agree with both of you, and we also talked about companies changing 3M, and you also mentioned, Sandoz, the parental leave to make sure there is better, especially in the United States, better opportunity to be parents and be with children when they're young and share the responsibility with the husband. The other thing for me that gets in the way, especially when people go into paths that are more technical or is the business, finance, strategy, understanding, and interest. And so I spend a lot of my time when I mentor young women focusing on that aspect and making sure that I'm holding them accountable from meeting to learn about competition, learn about what's going on in their business from a finance, learn the P&L, things like that, that I think for some reason, and I don't know if it's like gaming, but men are more naturally inclined to do.
That is so.
So I think that two things. One is that there is more guilt. I do. It's just some of it's biological, some of it's socialized. And for example, when I was offered this job, my Mormon grandmother said to me, well, how can you take that job? You're abandoning and neglecting your children. So here I'm dealing with that. I called 2 former secretaries who said, oh, you can't do that. Your girls are 3. How could you do that job? So
Were these secretaries men or women?
One was a woman and one was a man.
I'll be damned.
So it's interesting. So I think, so you deal with that and your own feelings over that. But I think there are people, and I agree with Fran, there are those of us who just feel like, give me the ball, I can shoot it. It doesn't matter how far, I'm going to make the bucket. And so I've always been like that too, and I worry about women who are not, and this happens to me a lot in my organization. My organization is 80% women, and there's so many women who will doubt. They may have, and there's data on this, that men may have 2 of the qualifications of the 10 that are needed, but they assume they can do the job, and women will have 8 of the 10 and say, well, I'm not yet ready. And so how do we teach women and girls to be confident and to take a chance and to have faith in themselves that they can grow, and how do we help them develop those skill sets that they need?
I just wanted to pick up on something you said, Silvia, about the mentoring. And I've realized that I've started to change the way that I mentor guys as well. Because, and these are huge generalizations, right? But generally, the guys are always like, I'm going to do this job next, and then this job, and then this job. And it's all mapped out, and it's so clear in their mind. Whereas, the ladies tend to be a little bit more like, I want to continue to grow and expand my responsibilities, a little bit less specific. But I find myself helping the ladies to be a bit more specific, but actually challenging the guys a lot more to say, do you really want this? Or is this what you think you should be asking for? And I spent a lot of time with the guys who half the time don't even really want it, but feel like they have to say, yes, I want to be the general manager. I want to be this. But then they don't act in accordance with those words. And when you really ask them to be a bit more self-searching, then they realize, well, actually, no, I'm not sure I really do want it. So it's interesting how it starts to slip over onto the male side of the agenda as well.
I want to. This is our kitchen table conversation, right? So I want to pick up on something that Rebekah said. In terms, I don't know if anybody has read Originals by Anne Grant. I love that book.
It's a great book.
And I think that issue about confidence in women is, yes, there is a part that we need that, but he talks about status and power, and how, in order to be granted power, you have to achieve status in basic terms. And that it is a lot harder for women to be granted status to then take power. So I think it's a combination of almost like a self-imposed, but also that the society feeding that into women, that you need more and more to earn that power. So I thought it was a very insightful thing when I read that.
So if you need status in order to get power, but status is not something you necessarily grab in a corporate culture, you climb your way up to it and earn it, and someone bestows it on you, does that take you back to a patriarchal environment where you're waiting to be blessed by the man who is more senior than you?
I don't think so. I think you just assume you have that status and you act accordingly that you have that status and wait for someone to challenge you appropriately. So
and that's what we have to teach women, that they don't need permission to own the status.
I told you these key people were kick-ass women. It's unbelievable. What do you think of California's new law that For public companies, boards of 5 or less, may not even be public companies, but non-NGOs, there must be 1 woman listed as a director, and if it's larger than that, there must be 2. So looking for 20% representation of women on California, boards that do business in the state of California. Necessary to legislate, smart to legislate?
Go ahead. You could go first. I probably have a differing opinion on it.
I know it may break your heart that you have to legislate.
I'm not gonna. Yes, and I'm not gonna answer if it's correct because it may not even take hold because of some of technicalities about the law. But I think it puts the conversation in the forefront. We need to have that conversation. It's better for companies to have more women in their boards. So even if it doesn't take hold for technical reasons, it's putting the conversation on the table, which we have to have.
Yeah, I think there should be diversity on boards as including, gender diversity, all sorts of diversity. Something about a mandate to have a certain number of women on boards bothers me. I don't ever want to be the woman appointed to a board because, I have to be there. I want to be there because I'm the best qualified or want it the most, not because I have to be there. So it kind of rubs me a little bit of the wrong way, but I do agree getting the conversation going and encouraging diversity is really critical.
It's interesting, because I feel exactly the same way. I'm partly kind of, yay, that's really good because it's going to help, but it's like, really? We have to go that route? For many, many years, I was asked if I would get involved in diversity initiatives in one shape or form in the organization. And I always said no. I was always like, I do not want to be that person who's perceived that, that I got any position, any role because I was female. I would die if I thought that was the case. And so I stayed really clear for a long time from anything to do with supporting diversity initiatives until I realized that actually, having lived and worked all over the world, I'd actually experienced, I lived in Japan for a year, right, where clearly, you look at me, I don't blend in very well. And so I'd lived in that environment where I'd been the outsider for a long time. And when I was traveling back, I had a very convoluted route, and I had this moment when actually I was in the airport in Amsterdam, and I was pushing my trolley through the airport, and suddenly, when you've got that feeling like I've lost something or something's not quite right, and I was thinking, what did I leave on the airplane? Oh my goodness. So I stopped dead in the airport, and I was trying to go through my inventory of what I should have with me. And then I realized that I was feeling strange because nobody was staring at me anymore. And I had been stared at either overtly or covertly for so long that it had become normal to me. And at that point, that was when I realized, okay, this is not about me being female. This is about what it means to be different and not feel included in the workplace. And that's when I stepped up and started getting more involved in diversity.
That's one of those huge aha moments. So how did you take that immediately and make it work for you in the workforce?
Well, I was lucky because fairly soon afterwards, I was actually asked if I would chair a D&I executive council, which I jumped in wholeheartedly. But I think it's in terms of, first of all, always giving a voice to people that you feel are underrepresented, either through choice because they're not speaking up and you help them to have a voice, or when they're not being heard, because I think that is really important as well, because a lot of people speak up, but you need to listen as well as speak. And so I think that's really important. And I actually had another kind of like breakthrough moment for me when I was talking with a group of people from HR about diversity and inclusion. And often that sits within the realms of HR in an organization, and they're held responsible for it. And I said to them, so what are your responsibilities when it comes to D&I? And everybody was talking about hiring and quotas and diverse slates and all the things that we all know and love. And I was like, okay, those things are all good, but actually you have a different responsibility. Every day when you're in a meeting, if you don't feel like the right people are sitting around the table to have diverse perspectives, then it's your responsibility to call it out. So it's each day, every day. It's not just the things around hiring and positions. It's about making sure everybody gets their voice heard and listened to in an organization.
So I'll just bring up a different career path, but as Secretary of Health, what I find is I'm a practicing OB, continue to, although the legislature tried to pass a bill preventing me from practicing, saying that as a woman with all these responsibilities, how could I do that and see patients one day a month? I couldn't possibly do my job. So, but anyway, I think the one voice that is not in the room in my conversations is that of the patient. And it's really interesting to me that we have this incredible medical industrial complex and billions of dollars are spent. And the last consideration, it's first, can we pay for the new wing of the hospital? Can we build the robot? Can we do whatever? But the last thought is, can Mrs. Jones get a mammogram and how is she gonna get there? And so it's been really rewarding for me to be able to bring the perspective that I have as a practicing doctor into that room. That we may talk a little bit about our work on Hep C, but that's the same perspective that we brought to Hep C. It wasn't about, so we may be the first state to have a subscription model for hepatitis C, really the first state to have aggressively taken on what is the leading infectious disease killer of our time. But we didn't ask the question, could we have a better deal from pharma or could we just negotiate a better price? We started with the premise of people are dying, they're suffering, we can't solve this problem with the money we have, please help us do this another way. And it was that asking and that asking of it in that way that I think opened the door, I'm hopeful, to what might be a real breakthrough. So I think it's always thinking of the perspectives that aren't in that room. And the other mantra that I have is nothing about me without me. So when we think, and that really comes from Don Berwick actually, but we think, and you're on the board of IHI, but when you think about that, is that we make so many decisions for vulnerable communities without thinking of the people we're serving. So we've just created an Office of Health Equity, and we're really trying to, in everything that we do, engage communities in making those choices and getting their voices and incorporating those in our decision making. So I think that's a really important perspective. It's not just in leadership, but how do we make decisions in our companies? What types of diseases do we address? How do we interact with vulnerable communities and making sure we hear those voices?
If you weren't a female, if a man were in your present role, bridging medicine and the Department of Health, do you think Hep C would have been a priority?
I just don't know. I think I got mad about the issue when I started working on pregnancy outcomes. The only treatment we have is 17-hydroxyprogesterone. It's a medication injectable that we give for women who have repeat prematurity. So I became familiar with this issue around vulnerable women who couldn't get medication because it was too expensive for them. I know, this is a generic, so we're in a friendly space here. We're talking with companies that are really trying to solve these issues. But, as a caregiver, I don't know if it's about being a woman, but certainly as a caregiver, I think that perspective informs. But there are a lot of men who care a lot about their patients who would have thought the same thoughts, probably.
Interesting. When you realize, and there have always been moments when each of us has been in this situation, you sit down for a meeting and you think, wow, there are a lot of women in this room. And then you realize as you sort of do that count around the table, whoa, it's 40%, it just seemed higher. Or maybe sometimes it's 50%, you go, whoa, I thought for sure it was 70 or 80. You just have this visual tip in your brain because it's not just one. Take me into the time that you remember a meeting like that and extrapolate how different are meetings run when there's a gender balance, even if there's not parity, when there are almost equal numbers of men and women. How do those conversations change?
I'll share. We had an executive event, and we had about 100 executives, and this table was formed by coincidence. It was just women sitting at the table. And then someone comes and says, what is it with you women all sitting together? And then we turn around and I said, there are like 6 tables that it's all men, but you didn't tell them anything. It's just, that is so unusual because there are so very few of us. And I think it does bring a different dynamic when there is more women. There is more dialogue. There is a better perspective on, or more discussion, I feel, when it comes to people, and a little bit more of the caring side, if you will. Not that men don't care, it's just that you bring it up more in the conversation. And I think a very critical thinking. You know, we've been always challenged, and so that we were very thoughtful and bring to the table things that are being pretty well thought out. That's not in comparison, but I think it's the advantages we have.
I think we are judged, though, because people assume that we're going to be nurturing. And sometimes I want to be nurturing, and sometimes I don't, right?
So when you're
if
mean, are people surprised?
Or just not mean, but stern. Like, this is what we need. And then I had an employee recently who wanted to have lunch with me and make nice, and how can I be your friend? I said, that's not your job. Your job is to do your job, and that's how we're going to be good. But I think people expect that when you're a woman that you're, I mean, what is expected of me in terms of being nurturing, supportive, knowing about the family, knowing about the birthday, knowing about the kids is different than what is expected of men. I know this because my predecessor, we just didn't expect any of this of him. And all of a sudden, and so it's hard to navigate, and we certainly saw this in the president. Whatever you think of Hillary Clinton, I think if you're harsh and you're stern, you know, you are judged more harshly for that as a female than as a male. And so navigating that, and I tend to be a very touchy-feely, so I get along with the general conception of women, but when I don't, sometimes I run into issues. I don't know if you all agree with that.
I'll make a comment to that. I think when you're not touchy-feely, and by nature, I'm really not. I mean, I'm nurturing, I have children, but people will just automatically assume that you're extra aggressive, and therefore, you know, you don't necessarily fit the mold. Like, well, how could she possibly be a mother if she's so aggressive? You know, but you can be assertive, and so you really have to stop and think and understand how to navigate the situation, because there are expectations that are put on you.
I don't know. I feel like I'm just myself all the time, and sometimes I'm definitely touchy-feely and happy and nurturing, and there's other times that I'm definitely not. And
So
it's just
the
me.
times that you're not and you come down and you're tough, can you read it in people's faces that they didn't expect that from you?
I don't think so. I think they know me well enough that that's how I am, and I can be very firm and have a smile on my face. I can do it in the nicest possible way, but I don't think there's any lack of clarity.
So, but I think there is, to this conversation we're having, there is truth. So in my case, I get the double, right? I'm Latino and woman. And so I get often that I can be intimidating. And intimidating because I'm
Have they met you?
But it is that, you know, it wouldn't be intimidating in a man, but it's not expected.
So because you're Latina, it's intimidating from a cultural standpoint.
Because I am woman and Latino, and I'm strong, and I have something to say, and I will say it, and colorful in the way I say it, because I'm Latina.
Do you guys swear?
No.
You don't swear?
No.
You swear, Carol.
do.
I know you swear.
I'm English.
Do you
We
swear?
use swear words as punctuation.
Yeah.
You mean in a work situation?
Try not
No,
to.
I mean, do you swear?
Just in general?
Do you swear?
Oh, yeah, I can't lie.
So, no.
No in the work environment.
No in a work
Oh,
environment.
I get no. Forget the work environment. Do you swear?
Yes.
Okay.
Occasionally,
Occasionally. Yes.
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 All right.
Okay.
But I'll
But I
pick up
don't
on that.
expect you to. If you told me you swore in the workplace, we have issues then.
Well, here's what happens. There are women, and I feel that I have earned my status and my power because of who I am as a woman. But other women, and most that came before us, it was so hard for them that they emulated the behaviors of men, and swearing is one of
Is
them.
one of
So
those.
I make a point on not doing it.
Well, I was in
That's
a meeting.
lofty.
Yeah, we were in a meeting about disaster preparedness to Louisiana. You all know about Katrina. We have a lot of work that we do to prepare for and to deal with weather events. And we were in a meeting with a new women leader, and she was GD this and F that and pounding the table, and it was really off-putting
help.
to me. No, it looked like a crutch, and it was. It's not. I try not to, although it's definitely in my verbal. Yeah.
A few words.
You know the words. It's good. So, because the four of you have very global experiences, professionally and personally, take me to Europe for a moment, or to Latin America, or to Asia, and the difference with representation of women in the workforce there. What is the United States doing well, and what do we have to learn from our geographic neighbors?
You want to take Europe?
So interesting. So I've gone backwards and forwards over the last 20 years between the US and Europe and different parts of Europe. And so I think from a representation perspective, actually the US was ahead. So back in 2006, when I first went back to Europe, actually I was on a leadership team that was literally like 50-50 in terms of men and women. And when I came back to the US, that was the same. I actually moved into a role when I moved to Switzerland the first time, and I was the only woman again. So that was a little bit strange for me. It felt like going backwards a little bit. And even though I knew all of these people, I felt a little bit excluded at first. And I really went through this journey of reflection, like, why do I feel this way? And it was nothing big. There was no one big thing. It was all the small little things that happen that make you feel that way. But, you know, you get used to it, you reacclimatize and get back on with it.
But was that situation fixable? Did you bring it to anyone's attention that I'm the only woman here?
I did. Yeah, and I had a mentor who was very senior in the organization. I told him all about it as well. I don't think he knew what to do with it, but he heard it. And I don't think we ever talked about it again, but I tell a lot of people that because I think it was at that time was a lot to do with the Swiss culture. And actually we had a lot of difficulty getting people to move from the US to Switzerland to work at that time. And so I would share and say, well, listen, you know, I'm European. This is not about Americans. Maybe this is about Switzerland. So we had, you know, a few conversations around that, absolutely. But over time, I mean, now I sit on a leadership team where, you know, we've passed that tipping point. You know, we're more than 30%, and you feel it. It feels different. I think, and we were talking about the California law in the UK, there's, I don't know if it's law or not, but certainly there's guidance that there should be at least 30% females on any executive boards, and that is closely monitored. We have much more transparency around pay gap, so every company in the UK has to publish what their, their pay between males and females. There's still more to be done, absolutely. But I see a lot of progress there. I think there are some things that by law we're still not allowed to do in the US, such as, you know, we can set ourselves internal goals, but you're not allowed to monitor certain things, right? And there's certain things where you can't.
Can you give me an example?
Well, so in the rest of the world, from a Sandoz perspective, Novartis as a whole, we monitor exactly what representation is at different levels, not just gender, but different types of representation, and we set goals. Now, you can't do that in the US, right? So we can monitor, but we can't actively set goals around that. So those are some things that hold us back a little.
So is that an inherent weakness, do you believe, in the American model?
Well, I'm not so sure, to be honest, because I think setting the goals is one thing. I mean, monitoring and seeing how things progress over time is great, but you really need to do something. We keep talking about BHAGs in our company, right? So the big, hairy, audacious goal. And from a diversity and inclusion perspective, I think certainly the boards that I've been involved with, we've just said, let's do something. Let's put a crazy goal out there and just say we're going to do it and make it happen. And it's not about monitoring these small changes that happen year over year. It's about something out there that causes change.
So I think for sure there is stereotyping of Latino men, and I think there is all kinds of men in Latin America, and there is wonderful women that are extremely accomplished. We had a wave of women presidents as well. But it's more, it's less out in the open. And I think that's what I really appreciate about the United States. We're having this conversation. There is discussion around laws and regulations, and there is more left to the companies, to the people. And there is a lot of opportunity still. I moved, it was 20 years ago, but I moved to the US through 3M. And my husband, who is an architect, left his career to come along, and his friends were like appalled that he would just pack and come with me for my career. It was not, he's supposed to be the one in charge, the breadwinner. So it's going to take more time there. There are things that are better, and one of them that I talk for women that are better in Latin America, when I mentor women, I talk about in a company, we outsource what's not our core competency. We don't run our own canteen, and we don't transport. And we need, as women, to do the same thing at home. My core competency is being a mom at home and a wife. And I don't clean, and I outsource that. And I tell people, you may think that I can do that because of my position. I've been doing that since my most junior position because I believed I needed to relieve myself. So that's easier done in Latin America than in the US because of mindset. In the US, women feel they have to do everything.
So my best friend lives in Germany, in Munich, and I do think that there are certain things that are basics, particularly if you are moderate income, low income, and you're trying to make it and you have children. And I know for Cleo, she has free daycare, organic food, her elderly mother-in-law is taken care of. And I do think I had a come to Jesus conversation with a young woman a couple months ago, and she said, well, I want to be in the National Academy of Medicine like you, and I want to do this. And she said, but I have to get home every day at 4:30 and pick up the kids. And I said, just stop. I said, you've got to fix that problem, because if you want to do these things, you're going to have to be able to travel on weekends. You're going to have to work at night. You're going to have to be flexible. Your husband's going to have to pick up the slack sometime, or you're going to need to get some help. But the bottom line is, if you don't have enough money to do those things and you don't have family support, it's really hard or nearly impossible. And we make it impossible in this country to get affordable child care. I mean, even my own organization, the Department of Health, we do nothing. We don't even have paternity leave. I'm working on it. But until we have those foundational aspects in place, I think we can talk a lot. I was fortunate to be an only child, to have resources, to be able to never worry. But most people have to think about those things, and particularly people with 5 kids. I mean, forget about it. So I think we need to be aware of that and continue to advocate in our own businesses and our own agencies for what we know is foundational to women leading, which is to make sure that they do have help. Because we are the primary caregivers, not just for children, but parents who age. And we can't succeed if we don't help figure out how to solve those issues as well.
But the one thing we have going for us, I think, is that we're pretty good at asking for help as well. Right, so maybe if it's not the financial wherewithal to do it, I know that certainly many of my friends are very quick to say, can you do this for me? Like, I need to go and do that.
Don't you think that's an acquired skill? Mm-hmm. I mean, women, I don't know that comes naturally to most women.
Yeah, that's what I was going to comment on, that I think in general, and I mentioned it earlier, you start out feeling that you have to be able to do everything. That's it. I have to prove that I can do this all without any help. Whereas it's perfectly reasonable to reach out and outsource, ask for help, ask other women, men to help you with these other life activities. There's nothing wrong with that. We live in a society that we have to depend on each other. But I do agree, what was previously said, in the U.S., it is very difficult if you are just middle America, middle income, to be able to raise children and succeed in your career. It's very difficult. People need 2 incomes, and daycare is expensive. It's a very difficult situation. I was going to comment on Southeast Asia. I do a lot of work in Southeast Asia, and while there are a lot of women in many companies in senior technical levels, staff positions, at the most senior levels in the C-suite, there's very few women, even though you meet tons of qualified individuals.
Cultural issues.
Cultural issues.
So
Japan as well.
Yeah, oh, absolutely.
Japan.
Japan. Put that in
What
there
about
as well.
China?
Oh, yeah, Korea's good. South Korea is very good. I can't speak to North Korea, but South Korea is very good. I would hope not. Yes, I would think so too.
Yeah, we want to hear where you've been in trouble.
No.
Because because I would imagine any one of you in the wrong situation saying the wrong thing, we could have like an international event. Mary Madeline and James Carville were here this morning, so we got a little bit of politics. And I really don't care what party anybody is in, but I was struck by something that Nancy Pelosi said in the Oval Office to President Trump when she said, "Don't underestimate the power that I bring." And for me, it was one of those aha moments. It wasn't a Democrat against a Republican, it wasn't the head of the House of Representatives against the president. There was this woman who just said, "I am affirming the power I have just brought into this room." And I think my jaw dropped a little bit because, one, you don't see it that often, and you don't see it that often done with grace. Now, there may be iron appendages behind that grace. Nonetheless, she said it with great aplomb, and it wasn't like anybody fought her back. She owned the space. And I thought, what a great example for little girls, young women in their careers, those of us who perhaps are in the senior parts of our careers. You're not part of that yet. You're just in the middle of your career. To sort of know your power, and not in a trite way, but because you've skinned your knees before, you failed, you screwed up, you know your core competencies, you're not afraid to admit what you don't know, which 20 years earlier could maybe cost you a path to success.
But that takes us back to that status. She owned her status.
She owned her status.
She just took it and run with it.
Yeah. I don't think I would have thought it like that. Yeah. She owned her status, and in that came her power.
Yeah, yeah. And I think one for me advice is, for any leader, you got to be an expert on yourself, right? You got to know yourself inside out. What are your drivers? What are your values? What are your strengths, weaknesses? Tools, feedback, whatever you use, be an expert on yourself, but then love you for who you are.
So Silvia, let me start with you then. If you had to pick one characteristic that you know to be true that has made you a great leader, what is that one characteristic that you rely on in yourself?
I think I'm pretty good at building a team in an environment of trust and holding the team accountable to whatever we set, but at the same time be supportive. And that, walking that balance is a good trait.
Fran?
I think, although outwardly I'm not warm and fuzzy, I think what has really helped me is I really care. And I don't expect anyone to do anything that I wouldn't do. So in my whole career, when I try to set expectations for people, I always try to think, how would I feel if I were in that situation? And I think doing that self-reflection really helps with building bonds with people and having them really feel that they're part of you and part of the team and bringing the best out of people.
Carol?
So for me, it boils down to doing the right thing. And I always keep 3 words front and center. So one is integrity, one is humility, and one is courage. And so whenever I'm wondering about something, I lean back on those.
Excellent words.
So fearless and undaunted. So from a young age, I've been fearless. I think at the age of 25, I sued Walmart because they didn't provide Plan B in their stores, and we won. But I also, at the age of 30, was hit by an SUV, which killed my first husband and put me in a wheelchair for 3 months. So I do think that nothing could be worse than that happening to me. And so I wake up every day really with an understanding of how short life is, and I assume we can win the impossible. And so people say you can't do it, and so I wait a week and I ask again. And we can't do it, I wait a week and I ask again. I assume they've forgotten, and I assume we can do it. And so I just believe that the impossible is possible, having lived through unfortunately, what happened to me.
What books are on your bedside?
My dad's a university president and just wrote a book about the land-grant university, and a lot of, I have to say, in this job, I'm reading a biography of President Grant. I'm trying to learn a little bit more about the North versus South dynamic. That I've been called a Yankee, even though Utah was not even around when the Yankees, when the Civil
Still
War.
north of the Mason-Dixon line.
yeah, it's west. It's the West. So yeah.
Carol, what's on your bedside stand?
Whatever the latest trash is. Normally a beach read. I just finished, I read a lot. I read at least a book a week. So I just finished a David Baldacci book, but I always buy the trashy magazines that are just by the checkout in the supermarket. That's my...
That's your cocaine.
Yeah, that's like chewing gum for the brain, right?
Yeah.
Any kind of, this is not going to come out right, but any kind of war book. War intrigues me. It
From a
really does.
strategic
From a
standpoint?
strategic standpoint. And I will read
So
about
you remember that old
every...
board game, Stratego? Were you like
Stratego
one of those
or
people who could
Risk.
kill everyone?
I loved it. I loved
And
Risk. So any kind of war book to really understand the mindset that went into it and how wars are won and what people were thinking. So at any given time, there's one of those books on my night table.
Carol, thank you for admitting first. I read about two books a week, but those are like the ones I don't count. It's just like that mind. But I really like historic novels, and I just read a book about the Brazilian emperor that was very interesting. And then I forced myself to always be reading a business book, and The Originals is the one that stuck with me lately because I really got a lot of insights from it.
Can you all read more than 2 books at a time? Are you unidirectional in your book selection?
No.
You have multiple books.
Of course, otherwise you're bored.
And we wouldn't want that to happen to you. Well, I can't tell you what a kick this has been. So thank you, and I hope you guys have enjoyed this as much as I have enjoyed meeting you guys. So Silvia, Fran, Carol, and Rebekah, thank you, and thank you for being really great women leaders. Thank you. That's it for this afternoon, guys. You are now free. So enjoy your afternoon, and we'll see you back here tomorrow morning, I think around 8:30.